Hello, everyone, and welcome to Two Moms and Some Labels. Two Moms and Some Labels is a platform created for families caring for a child with a disability to come together in a shared space to learn how to persevere through challenging times. And we want to talk, network, commune, get together, and discuss our challenges. I'm Brittany.
I'm Nicole.
And
I'm
today we
Melanie.
have a special Melody, yes. And today we have a special guest with us. We have Melanie Provenza here from Early Steps. She is a family resource specialist. And so I'm going to let her take it away and introduce herself and give us a little bit of information about what she does and her background.
Okay, thank you so much for having me. I am Melanie Provenza, and I am the Family Resource Specialist for Early Steps of Northeast Florida. And we are the early intervention program through the state of Florida. Uh, Early Steps is one of the Early Steps Northeastern, I should say, is one of 15 Early Steps offices in Florida. So every county in Florida has an early intervention program. And here we handle the northeastern area of Florida and work with the children birth to 3 who may have either an established condition or look or show some type of developmental delay or be at risk for some type of delay that we would be able to possibly work with and help through intervention by helping them in the natural environment in their home, working with a provider and a service coordinator and the family resource specialist. We try to help the children, with doing evaluations, providing resources in the community, and supporting the families of the children by doing what we can to help. I wouldn't say really bridge the gap, but help with them being able to feel as though they are getting the therapies that they could help their child if the child is showing some type of delay, or again if they have an established condition, just trying to help the family feel like they are doing all they can possibly do to help, such that that's because it is such an early age, the birth to 3 age, that early intervention is so important to try to work with them because they are so young and so willing to learn and so able to learn at that age. We find it pretty critical that they are able to work with us. And again, we serve the northeastern part, but every part of Florida has an early intervention program. Pretty much, I think every state does, and they might call it something different, but in Florida, we call it the Early Steps program.
Yes.
Okay. And you had touched on something that is really important, which is why we have you on today. And we're discussing this topic of early intervention, was that it's very critical and important for children age birth to 3 to receive these types of services or, become a part of this program. And so can you share with us a little bit why our early steps program is important, or why early intervention is important during this age group?
So I think oftentimes, like when parents are noticing, maybe a parent or a teacher or a doctor may notice, something just may not be where they feel that a child should be. If we catch it early enough, we want to be able to work with the child, hoping to help them develop, to help them work on these skills, to work on goals and skills that the family feels is important. And the one thing that I really want to stress is that the family is a huge voice in that early steps team. We don't come into the home with, okay, we've got this and we're going to do this. The family needs to have that voice. You or whoever, a mom would say, this is what I'm seeing. This is my concern. We want to hear that. We want you to express that. And that's where we want to work on your day-to-day routines. So we don't want to come into the home or into the child's natural environment and be, like another appointment or something that you have to wait for. We want to fit in to what they are naturally doing every day and see how we can work with you, the family or the caregiver, in ways that will help develop some goals and some strengths that maybe the child just quite isn't at yet, and work with them by helping them to develop. And, if a mom or a caregiver sees something that they're like, well, maybe they're not, dressing or speaking, or just something isn't quite where they feel like it needs to be. Well, let's come in and address that. But rather than work on it outside or someplace where you're not naturally at, let's do that within the home and integrate that with the family and with the caregiver, so that we're already providing these services that you're doing, that you may not even realize that you're already doing. How do we make it to where it's not an inconvenience for you, but we're still adding that extra oomph into what the child may need?
Okay,
I think
yeah.
when you touch on that about the family being involved, my son did early steps, and I think it was really great because when we got our gait trainer, to be able to, it's great to get it at the office and they fit you and boom, 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 but to have someone at the house to show you when to use it, how to use it, how you can use it, to implement him coming out of his room, helping in the kitchen, different things like that. It was really good. And then the toys that we had for him, she was able to sit there and work with him on just regular toys that we would get from Walmart or Target. It wasn't like a special therapy toy. It might have been like a 3-month-old toy. And she would show us how to do different things with him at the home. She would show me,
With
dad.
things that you already had.
Yeah. So we didn't have to go. It was just things that we got from either the baby shower, just toys that we
Mhm.
see, we pick up. And she was able to show us how to do that. Get a walker, how to have him comfortably sit in his high chair to work on feeding. So I think that was a great point to get the family involved, because sometimes when you go outside therapy, you might sit in the waiting room or you're sitting in a chair and your child's just working with the therapist. And then sometimes when you get home, you're like, okay, well, we don't have that equipment at home. So what can we do? So I think that's really good for families to take advantage, to be able to work in the home, in your own home, in
Right.
your own natural environment.
And oftentimes we don't discourage families from, if you're receiving therapy outside the home, and in addition, maybe we can add something to that. Like you said, you know, you don't really often have to change much of what you were probably doing anyway. You were just taught to coach and implement that in with your daily skills with what you were doing anyway. Maybe not even realizing that oftentimes you were doing it, and maybe there was just a few things that you could tweak or change that would really make a huge difference in what the natural environment provides. And again, there is a place, there's a time for, going to a clinic or going to a PPEC or to a school or something. But that is a misconception that people have, that people may say, well, early steps will give you this, and this. The main focus is to coach the parent to work on the skills that they really choose for their child. What is your main concern? What is your main goal? What is it that you would like to see the therapist come in and work on, that you really feel that we can help you with at home? Is it feeding? Is it speaking? What is it that you as a family member are seeing that is your main concern? Because I can walk in your house and say, well, here's what you need to do, but I don't live there every day. I don't see what's going on every day. I don't know the struggles that you have, that you may need the therapist to understand what is going on within the home, that maybe you can tweak and change, that can just help the child in certain cases. Like you said, sitting in a chair, using a gait trainer. Well, he has to get around the house in that gait trainer, so let's work on that.
Yeah, and a lot of times too, what we don't realize is that, or even I can say we do, because we might go into the therapy session at the clinic or what have you, and then you get there and maybe your child is not in a good mood that day or
Mhm.
something like that, or they don't like the environment, and so then you're like, oh my gosh, he or she doesn't do this at home, or we don't have this problems at home, and then when you're able to be at home in that natural environment or setting, then the child can be more comfortable, and
Right.
then maybe you can get them to do more things because that's where they're used to being, that's where they're used to doing stuff at and playing. And so that really helps a lot. And then where the parents or caregivers come in to play too is that when you go to that therapy session, that might be 1 or 2 days out the week, and it's only for 30 minutes or an hour, and there are 7 days in a week. And so if you are just depending on that therapy session for that 1 or 2 times a week for 30 minutes or an hour for them to work with your child, then your child is not going to progress in the way that you maybe would like, or they could progress a little bit better if you're actually taking the skills that you're learning also and working on those skills at home with your child. So when early steps comes in and they're able to work in the natural environment, they're able to show you with what you have things to do so that you can continue to work on it even when no one is there, since you are going to be with your child most of the time anyways, and you're just seeing that face once a month, once a week or what
Right.
have you. So it's really important that you go to these therapy sessions or you have someone come in, but they're there to teach you what it is that they can do to help you teach your child, to be able to increase or develop their skills better.
So we have a team at Early Steps who is coaching. They coach the providers to do exactly like you said. They have to go through a coaching sessions. They have to reach they are videotaped to where they are able to watch the sessions and go over it with their coach and learn what they are supposed to do to best serve the families, because oftentimes um, they are learning to work with the families in their homes, and that may not be what they're used to doing. Like you said, they're used to, maybe a family maybe used to going into a clinic and here's what you do for 30 minutes and then you come out and you've been outside talking to another family or on your phone. The main thing with Early Steps is we need that parent to be involved, because you're there every day. We come once a week for an hour, and when we leave, if you're not practicing and taking those skills every day or doing it more than once a week, how is that going to, it's really not going to do a whole lot for you or for your child. So that practice and that implementing those goals and skills and everything in your mind to think, okay, I'm going to work a little bit on this, and not to just feel like that's all I'm going to do. But oftentimes you're doing the bath, you're doing the feeding, you're doing all those things. But how do we do it to where it's not always such a struggle, where it's not always, you know, by the end of the day, you're just like, I can't. And
Right.
so this is where we're coaching and teaching you to help your child, to teach them to help you and to do more things as a parent. And as the coaching part is really where the providers who come into your home are making that big difference with your family. We want you as the parent to have a voice and say, here's what I feel that I want to work on this week. And we kind of make sure that these goals that we don't just say, okay, well, we'll skip this goal and move to that one. We want to reach these goals. We want to hit those mile markers, and at the same time, make sure that we're seeing the progress and that the parents are understanding where we're coming from. We're not just saying, well, here's some homework, go home and work on this. You're doing it hands on, hand over hand with the therapist in your home. You can't get much more natural than that.
Right.
Yeah. And then even just going back to why it is important between that 0 to 3, because the brain also
Mhm.
is learning, it's growing, it's developing. Um,
It's a
it's
sponge.
trying to grasp all those skills that they need, those life skills, daily skills, just everyday skills that they need to develop, and the cognitive skills. And just like you were saying earlier, you go and take your child to the doctor and then they are asking you all these milestone marker questions, and then when you see that your child is not meeting those, because these are things that we're expecting during those ages, that time of growth, for them to be able to meet those different markers and grow. And then when you have early steps come in, they're going to help and assist with meeting the goals, like you said, like, so those would be goals that the families would be
Mhm.
working towards or working on, um, so that they can continue to move on to the next level and not per se catch up, but be able to do something that they weren't able to do previously before early steps came in. And so um, how does a child get onto the early steps program? How do they
So
get into it?
if a child is, first of all, if they have an established condition, if a child is born with an established condition, and we have a list of those, there's quite a few, so I don't want to read them to you. But if a child is born with an established condition, they would automatically be eligible for early steps. And some of those things just be natural spina bifida, cerebral palsy, certain things that a child would have, that diagnosis would automatically make them eligible for early steps. Oftentimes we would get that referral from the NICU or from the hospital somehow or other, before you left the hospital. In my case, I'm just going to use my personal, and I'm sure maybe in yours too. When I left the hospital, I had a piece of paper that said, you have an appointment at early steps. And I'm like, okay, whatever. It was just another appointment for me. And I didn't know what it was. So my daughter had an established condition, so she was automatically eligible for early steps. We could maybe have a parent who wants to see something that's just not where they think it needs to be, and they feel like they want their child evaluated. A pediatrician, a child care worker, someone, so oftentimes we may have someone from foster care or from the court system who feels that the child needs to be looked at, where they would come in and have a early steps evaluation. And from there, we do our testing and determine if they are eligible for our program. The children need to be between the age of birth to 3. And at the age of 3, this is another thing that people automatically assume, and it's not the case, is that if you're in early steps, you're automatically going to move into the school system. That's a whole nother thing. When the child transitions from early steps, there's another set of testing that the school system, if that's the path you choose, would determine whether or not the child is eligible for more services after their birthday, after their 3rd birthday. Because we get that question a lot. Will there be? I think a lot of parents think they're just going to but there's a different set of testing. And I always tell parents, if your kids don't qualify for the school system, that's not a bad thing. That means that they've made progress and that they've gone beyond, and that they've done really well. So it's not just a early steps and then the next step is the school system. That is a whole process to go through, a transition from that age 3 into whatever county that your child lives in.
Yeah, and then so I know Nicole said that Lorenzo had early steps, and then you say your daughter, okay, and so we were on early steps, but we kind of almost missed the mark, the age cap, and so I think we maybe got a year and a half of early step services, and why I feel early steps, and just early intervention period is so important, because we missed those first 2 years of possible intervention that we could have had. And so when my daughter was going to the doctor, and we did those, you got to follow up at 4 months, 6 months, 9 months, 1 year. And we were going to all those appointments, and I don't even remember the doctor asking, is she rolling over? Is she sitting up? Is she, I don't remember him asking that, because, here we are about 2 years old, and she's still not sitting up. She's still not rolling over, but we weren't referred to any early intervention or outpatient therapy until it was later. And I always say, and I feel in my mind like, oh my gosh, if she was referred, after, I would even say 6 or 9 month appointment, then we possibly could have been further along with her development,
right?
Than where we are now, if she would have got that early care, because at that time, that's when she was learning how to do everything. And we didn't know, they didn't tell us.
As a first time mom, you don't know, you don't know what to expect.
Yeah. And so I'm always like, man, if we would have had that early intervention and had it, at that, as soon as we could have, then maybe it would have made a difference in her development and growth. And that's why I am always like, it's so important. It's so important. Make sure that you are looking for those signs and going to a pediatrician that is, monitoring those things. Yeah. Because it's just so important. And I
Mhm.
know we had talked briefly too about why we like got into our career fields
Mhm.
or fields of work or what have you. And so I became a specialist or a advisor with the deaf and blind school because it's an early intervention program. And my daughter, she needed early intervention. And what I was able to learn through the program and knowing that I'm helping children in these early stages to grow and enhance their development and skills and assist the families, it was so like important and touching to me because I know it was a piece that I had missed out on, but to get it so late, but even though it was so late, I still was able to, learn so much and help my daughter move further. And I wanted to be able to kind of like service other families in that
Yeah.
manner so that
Provide those skills
they,
what you
yeah,
learn.
that they wouldn't miss out on that, and that they could learn and then they could help their child and, maybe pass along the information and their knowledge that way too. So that was the early step service was definitely something that helped me in my personal life and in my career life because I was able to learn so much and help other families. And I'm just so happy that I was able to be able to do that and kind of feel like I paid it forward to, those other families.
That's
And
awesome.
okay, let's see. So how long does it usually take for a child to be able to get on the program? Is there a waiting list
Well,
or?
you know, we had COVID, so that kind of just knocked everything over the side. And I feel
Mhm.
like we're recovering from that now at this point. We had a little bit of a internal staff change recently in the last 6 months. So
Wow.
we are doing clinics and we have kids coming in for evaluations. Um, we normally, what I tell parents to do is if they're suspecting anything, like in your case, if you're suspecting anything, it sounds like, you may have talked to your doctor, but he just didn't guide you in the right direction. So I always tell parents, I'm like, if in your heart you feel like there's something that's just not right and your doctor's dismissing it to the point where it's bothering you, you can always try to make a self-referral. If you have a 1-year-old who's not speaking, dancing, and doing everything, that's one thing. But if you are actually looking at milestones and your child's not meeting them by a certain age and your doctor is not showing a whole lot of concern, but you continue to feel that feeling where you're like, I just feel like something's not right, I
Mhm.
say call and talk to somebody at early steps, let them know that you've spoke to your doctor, you're something as a parent that you're not seeing that's just quite right. In your case, you didn't know you were a first time mom, but looking back, as you said, had you known now, you probably would have done a self referral and just said, look, I'm
Yeah.
not waiting around for her to be 2 years old and sitting and waiting for him to tell me or her what she should and shouldn't be doing. So I always tell parents, to talk to your pediatrician or somebody if you feel that there's something not quite right. And if you're still not satisfied with that answer, go ahead and call. Go ahead and call and say, as a parent, I just feel like something isn't quite right. And we can do a screener and we can talk to you about, having your child come in and be seen if there's something, and it's hard for first time parents because again, they don't know what to expect. And I feel like we're starting to do screeners, and that may help with a family really understanding what to actually be concerned with and what maybe you may be having too high of expectations. But I'm sure, like you said, something in you was telling you, your doctor, hey, she's 2 years old. She's not doing what she should be doing. And then you look back now and you think if this had been your second or your third child, you
Mhm.
probably would have seen it a lot quicker. But
Yeah.
how would you know? So you're really, really depending on someone to do that for you. So if there's something or somebody, maybe a daycare worker or somebody that's just keeps saying, hey, just get them checked, get them screened, see what happens, call us. I would rather somebody call and hear, no, no, he's fine and go through that than just to let it be dismissed for several years. But right now, um, what we do is we will go through and um, we have a referral. The way that we have the referral, there's a calendar that we have clinics. We have a main clinic downtown. We have a clinic that we do in St. John's, a clinic in Clay, and then a clinic on the west side. And we do our best to try to get these kids, but you also have to remember that we had an influx of kids that came in after COVID.
Mhm.
Um, a lower population of providers because some families only wanted to do virtual. Some families didn't want anything to do with virtual. Some providers only wanted to do virtual. So we kind of had to go through that. And I feel like we're at a point where we're maybe, getting back to where we are getting our calendar on schedule. We're able to see the kids. I don't know exactly if there's a wait. It's not like, where when people say they call to have a diagnosis for autism and it's a year wait, we're not even close to that.
Mhm.
I always suggest to call, have your pediatrician send the script. That's probably the quickest way to do it because it's coming in that way. And if you have to pester your pediatrician, so be it. Do it. If you feel in your heart that there's something that the child needs to be seen for,
Mhm.
then wouldn't you rather be wrong than, have missed something? And I always tell families that, like you said, early intervention that's a short window. 3 years is really not that long of a period of time. And if we can get you in and we can at least get some services in place, then I'd rather see that than not.
So, do you think that there is a reason that some families don't know about the program or know that there are resources out there to help them or that they should be looking for resources? Because I know there's been a couple times that I've ran into families and they're like, "Oh, I didn't know anything about that," or I didn't know that was there, or I didn't know who I
No,
would ask about that.
I would love to believe that, especially during COVID, I went to, because every office was almost like kind of closed, so to speak.
Mhm.
And during COVID, I had a list of like all the pediatricians in all of Northeast Florida. And I went around with little packets and told them, we're still doing virtual visits and here's our referral form and here's what to look for. And I bring these developmental wheels. And the developmental wheels kind of have
Mhm.
little red flags on them, to where a family is, maybe if you're not seeing this and this and this and this, go ahead and call us or talk to your doctor and let's talk about maybe doing a referral. And I'd like to believe that I probably got every single office in Northeast Florida, but that was, like I said, in 2020, a couple of years ago. Most pediatricians should definitely know what early steps is. That doesn't mean they all do. A lot of daycares, a lot of birth to three caretakers um, may not know what it is if they've never had a child with any kind of developmental delays or had
Mhm.
anything before. I had two children before I had my daughter, and when they, like I said, this has been years ago, but they just handed me, to me, it was just another appointment to go to, and so sometimes that's what it looks like, and you get that evaluation, and then you realize that it's ongoing services, which is awesome. But oftentimes all of this is really, really new for new parents and they don't
Mhm.
know what it is and they don't know what a PT or an OT or, we didn't know what that was before until now it's like part of our everyday life. But
Right.
I feel like I would hope that most pediatricians would know to refer a family to early intervention.
Yeah.
I used to work in a doctor's office, and we had a pediatrician side and adult side. And this is after I had my son, so I'm kind of like, oh, the mom's saying something, pay attention. And I would notice sometimes the pediatrician would be like, oh, it's a first time mom, they're overreacting.
Oh.
Even 2020, 2021, they would kind of dismiss a first time mom. Um, and I feel like early steps, early intervention is just kind of like the NICU. You don't know about it until you're
Mhm.
there. So I
Right.
think early steps doesn't come into conversation because, of course, you want a perfect pregnancy and you're going to have this child and everything's going to be fine. What you see on TV. And then it's like, okay, well, and the grandparents sometimes chime in, oh, that baby's going to get it when it's time. Give
Right.
that baby
Right.
time. And then as the time is coming, you've hit 3. And, those doctor's appointments, they're 15 minutes in and out. You're mostly with the medical assistant. I think the best thing now parents have, because I think Brittany and I talked about this before, the difference for me in 2017 and Brittany 13 years ago, technology.
Right.
So I was able to, while Lorenzo was in the NICU, I was able to sit on my phone right there bedside and Google everything. I was able to contact other moms on Facebook, and they would be like, oh, you make sure you talk to them about early steps.
Right.
When he comes home, the nurses would say, oh, when he comes home, you're going to get early steps. So before he was discharged, August 2019, I'm calling early steps and putting my appointment in. So by the time we got out in August, we were doing our eval. Miss Gwen and all them came to the house in September, and he was seeing Miss Jill by October.
That's
so
awesome.
It was already implemented. It was known to me technology and reaching out to other moms. So I think with a lot of parents now being able to hopefully take advantage and connect in the Facebook groups and hit those milestones. The CDC website has them as well. I constantly look to see where what Lorenzo is hitting at certain times to make sure we're there, or do I need to address certain things? One thing I do notice that it really kind of sometimes hinders in the African American community. And it's honestly a great resource for the African American community. Because sometimes it's a one-parent household, right. Transportation is an issue and everything like that. And when we're saying how do families talk about it, that's awesome. You gave it out more at the doctor's office and stuff like that. But I think how we talk about WIC, we need to talk about early intervention, right. And making sure doctors are quick to fill out the WIC form. If a parent shows concern, we got to have them fill out that referral form.
Well, and it's too, like, even now, when I talk to, if I'm just having a conversation, like with someone outside of someone like you, and I'm just like, yeah, over at Wolfson's, they're like, what's that? And you're like,
no.
It floors me. But I think to myself, well, they don't have to know what Wolfson's is. Yeah, no, it's at Nemours. And they're like, what's that? And I'm like, you don't know what Nemours is? And I think, well, you didn't know what Nemours was, and you didn't know what Wolfson's was before this. But it just, I always tell family, like, if you don't know what it is, you're very lucky to not know. It's a beautiful and wonderful place, but you're lucky if you don't know what it is. But you just assume, like, I have gone to households before, and my job with Early Steps is that I had a child who went through the program, and I am supposed to be able to understand and relate and have a family's perspective on what it is like to have a child with special needs or be going through the program. So even though we have service coordinators and we have people who are there to help you, sometimes a family's like, so I know what it's like. I've been through it. I'm here to help you. What can I do for you? I'm a mom that already went through this as well. So I'm on both sides of this fence. And as you said, in different communities and cultures, a lot of this is not accepted in certain cultures. A lot of fathers, and I don't mean to point fingers,
right?
But I find this more than others, will not accept that their children have special needs. He's going to be fine. He's going to grow out of it. He's going to get over it. I've noticed this in different cultures too, where I've had families where they can't tell their moms or their families that their child has autism because it's not accepted in that culture, and they're not accepted into that lifestyle. So they hide it, and they're lonely, and they're not able to share anything about their children because their families will not accept, nor will they understand why that child is not doing what everyone else is doing.
And that's a good point too, because I actually was thinking about that the other day when I was writing something down, and I was like, before I had Ayana and we went to the Moors and Wolfson's, I had never saw any children in wheelchairs with special needs, especially particularly in the African American community. When I went out in the public, I never saw them at the mall. I never saw them anywhere. And until I had her and I started taking her to appointments, I was like, this is the only place I saw them at, was
I
at the
often
doctor's.
found myself when I would go to Nemours, if I saw a child, an African American child with a grandparent,
Mhm.
oftentimes they were with a grandparent and not the parent. And
Yeah.
I don't know, and I feel like over the years this has changed, and in
Mhm.
different cultures too, that maybe it's starting to be a little more acceptable, but I would always be like, well, I wonder why their grandmom's with them, and their and it would always be, was never a mom. It was always a grandparent. And I don't know if
Mhm.
they were working or if maybe they were helping to raise, but oftentimes I'd run into families and they'd say, oh, we're raising this child, and they'd be in their 60s and
Yeah.
raising this child in a wheelchair with a lot of needs. And I would think, oh
Mhm.
my gosh, that's a lot to put on somebody at that age to be doing that.
Yeah.
And then I've had a family whose her child, the child had Down syndrome, and the family lived in another country, and she did not want her family to know anything about it because she said if they do, they would not really want anything to
Wow.
do with her or with the child.
Wow.
Goodness.
So she was hiding, basically shamed by that,
Mm.
and so our support groups are our play groups. And then, at least she had those people in her life who understood, and they were like, okay, they were accepting of her, and we would have play groups. We do a play groups at early steps for that reason, because
Right.
not everybody can be at, the circle time at Gymboree or be where everybody else is. There's certain things where when we do our play groups, we do them in the community during toddler times and during different activities that other children are doing who are typically developing, so that they can be a part of that, so that other children can see that, so that other moms, and we often have other moms who may have thought that, like, can I ask you something? They were too scared to ask and I hate to say this word, but their perfect friends with,
Mhm.
their perfect children, because they didn't want to ask them, but can I ask you something? Because they wanted to say, I think my child might have something, but they felt like that friend wouldn't understand that. So they
Mhm.
would come up and they would ask us, and we were always welcoming and, yeah, sure, you can, whatever. And many times they would call and get a referral, and actually come to find out, they knew something was off. Maybe my child, I feel like he's not making eye contact or he's not listening or whatever, but I don't want to say anything to my friends because their kids aren't like that. So they
Mhm.
didn't feel accepted. They just want to, like we all do, we just want to feel accepted, when we
Yeah.
want our kids to be accepted. And that's where the play groups and being in early steps and knowing that, there have been many times that I've done play groups and a family will show up with a kid that comes and I'm looking like everything, and the mom's like, we're just having a good day. That's all today.
Yeah.
Because you're wondering, like, oh, okay, wow, this kid looks really, and she's like, no, this is just a really good day. You didn't see yesterday or last night or this morning. So, never judge a book by its cover, I guess is
Yeah.
what we can say.
Yeah.
And I think when we touch on the African American community, I know where the office I worked at, a lot of the population was on Medicaid. So the population that was on Medicaid at that time, they would not come to their well child appointments. Oh, she's fine, so we're skipping important appointments. These appointments, you need to get there on time. You need to give the doctor the time. You need to come prepared with your concerns. So I think too, it's more education in our community
And
as
maybe they weren't raised that way. Maybe they weren't raised from a mom that did that to them.
And I think that's what, yeah,
Mhm.
more
Right.
education from the time they're pregnant, and just talking about it more, how important those well appointments are. Because if you go to certain zip codes, that mom is going to be at that well appointment. She's going to have
Mhm.
her paper
Yep.
written. Oh, she's not doing this.
Yeah.
She's not doing this. She's not doing that. I need a referral to Nemours to see the
Right.
ENT, get a swallow study.
Yeah.
You're going to do that. And I just want more parents, because this is a free service
Yes.
that they're able to provide and able to have someone come to their home. And it's a great opportunity. So I
And
just hope.
maybe more role models are needed in that
Yes.
community. Maybe great role models like you.
Mhm.
I have moms who come to my play groups, African American moms who are the most fabulous moms in the world. And they live in, I mean, Nocatee and places where it's not, but they need to, maybe some of these moms in those zip codes need to see, you're just exactly like this mom. You're exactly like this mom. You're just like this mom. Just because where you live and how you were raised, don't let that, be the what you feel like, you're now in charge. And maybe it just takes some education and some role models to show them you've got that strength. You've got it in you. Let's work together to do that.
Yes. And I think too, when we get back to going to more legislation and talking about the hardship financially on parents for special needs, and the different impact it makes on family dynamics financially. So sometimes when you do see those grandparents at the doctor's appointment, mom is working because she can't live off of the SSI. Right. She doesn't have anyone. Sometimes a lot of moms are either working weird hour jobs. Even if you're a nurse or a CNA,
right,
your hours are very different and traditional, and you can't miss work because you might have missed work when they were sick. And that's the best part about having a support system,
right,
as far as a grandma and granddad, because even when they come to the house for early steps, if we're all living together, you're able to, while mom is at work, you're able to work with the child and the grandma to go ahead and help that child get the therapies they need. But I think that has a lot to do with sometimes why the dynamic with the different zip codes, it definitely is like financial hardship.
Well, I can speak. I can't speak for everybody, but I can speak for myself, and I can share this with you that I had a beautiful home in Mandarin and 3 children, 2 of which were in private school. And I was married for 14 years, and my husband decided to walk out on me. So I went from having this life that everybody would think, oh, look, she's this, middle-class mom with these 3 kids, and her kids are in Catholic school, and she's just whatever. And I drove an Acura. And I remember when he started having an affair and he walked out on me, my entire life had to be reinvented. And I remember thinking, my kids are going to be the only ones in this school who don't have a dad that's involved. And what am I supposed to do now? And that's how I started working for Early Steps. I had worked for Merrill Lynch for many years. When I had my son, my ex-husband, who is the one who did this, he was going through school to be a physician assistant of all things. And we decided that he would go to school. We moved to Georgia, and we used my 401k, and we put him through medical school.
Oh gosh.
We back home, and I had another baby, and from the outside, and everything was fine in my eyes. We were living this beautiful life in this great home and 3 kids. And then he decided that this just wasn't what he wanted. So it's not always what you think. I mean, we were in 32258 zip code in a beautiful home, and I had to reinvent my life. So, it was definitely a life-changing situation. And moving forward, I never saw myself in that position. And you're like, okay, it's time to reinvent my life, but it's because of someone else's choices. And I could have definitely used his help medically, because he was, really good at what he did at his job. He was a physician assistant, like I said, and all the therapies and the surgeries and the doctor's visits and everything that I went to with Chloe, oftentimes they would say, well, we need dad's signature. And I was like, okay, well, dad walked out on us and moved to Indiana, so it's all me. Yeah. And so again, like, luckily the car I did, like I said, I had a nice car and I had everything, but that car had been paid for, thankfully. I thought that was one thing I always thought of. If I ever had to live, I could live in my car. So I'll make sure my car was paid off at the time. But no, we were basically forced out of our home and made to leave, and had our lights turned off. And, so I went from having a middle to upper class life to calling JEA, needing help, and applying for WIC, all within just a couple of years. So again, the book in its cover doesn't always show what it's like, because I remember thinking, oh my gosh, my kids are in Catholic school and everybody here is married and they have all these perfect families and they have all these. And I remember someone saying, Melanie, if you only saw what was going on behind closed doors,
Mhm.
don't worry about that. That's the least of your worries. So it's not always, that's why I said when I would see those grandparents, the only ones I would see, sometimes they would just look so worn out and they would, they'd be like, this is a lot of work. And I'd say, I know
Mhm.
it's a lot of work. I'm, 20, 30 years younger than you, and I'm worn out too. So
Yeah.
every single family has a story and
Yeah.
every story is different. Every story is different.
You're very
Yeah.
strong. Very strong.
Yes.
That's
Yeah.
3 kids and to have to do that all on your own. That's a lot, especially having one with special needs.
Yeah. And it turns out, and I'm glad that families can see. And I think probably one of the most satisfying parts of my job, like you were saying, Brittany, is that you can give back.
Mm.
You
Mhm.
learn from what you went through. And the only way I feel like you can ever feel satisfied from that is when you're giving back to someone else and maybe preventing them from going through a little bit of the hardship that you
Yeah.
experienced yourself.
Yeah,
Yeah.
that
Exactly.
is awesome. I think that is awesome.
And I see
Yeah.
that in the early steps families. I see when they come together, and I see sometimes they just make friendships because maybe some of their friends that they had prior to having that child, they don't have as much in common with them anymore. So they sometimes you have to make a whole new group of friends, and
Yeah.
that's your commonality. I see a lot of families in early steps do foster care, and oftentimes that's their commonality. They foster, adopt, and they come together in that way and become really
Mhm.
good friends with other people.
Yeah.
Because I mean, it's kind of like in the same kind of music or food or this, that's your life now. So you come together with someone who has things in common with you.
And sometimes I think it's good because I know with me, my son was on a vent when he came home, and she would come work with him on a vent, and we had our OT consult come every so many weeks. But the exciting part, we went to the clinic as well. We went like 3 to 4 times a week. But I'm a new mom of a medically complex kid, suction, alarm, feeding pump, everything's going on. And to have someone, I know they weren't coming to visit me, but to have an adult,
Mhm.
Right.
not really a nurse, an adult who can share with me their life of, oh, what are you doing this holiday? What are you doing this weekend? We're still working with our child, but to have some sense of normalcy and to be around someone that wants the best for your child is very good. But to have those conversations, and I know a lot of special needs moms, especially between the kids are 1 to 3, you're scared to take them out because of RSV,
Right.
everything else. So to
Well,
have that,
it's a lot of work too. It's a lot
yeah,
of work
all the
taking a
equipment,
typical
yeah,
kid out, a stroller, a diaper bag,
Yeah.
and then again, feeling like you're being stared at or looked at.
right.
And I was lucky because I had, like I said, Chloe, my daughter was pretty, but some friends, they don't want to be around you because they don't understand you. So you lose friends sometimes because they don't understand. They don't know how to act around you. They think they have to act
Yeah.
different and that you have to be
Mhm.
treated like, and you're like, just be you.
Yeah. And that's funny that you talk about that too. I'm like, we were talking about other things, but I have to tell my son that because he's 8, and so he's like, he's been saying to me lately, and it makes me feel like, am I a bad parent? Am I not teaching my child the, right way to treat people that have special needs because his own sister does, and he is like being judgmental. And but he has came to me and he was like, I don't like, you have the sign on the car door and people are looking at it that says my sister has a disability, or people ask me, like, what does my sister do? And I tell them that she's a cheerleader, and, or, like she does something that she never would be able to do. And, because he's embarrassed, he said, to tell them that his sister has a disability. And I try to tell him, I'm like, well, if they're really your friends and they're going to judge you because of your sister, then they're not really your friends, and those aren't people that you want to be around. And I have to tell them, like, you have other friends that have been around your sister and they don't think differently of you. They don't want to not be your friend because your sister has a disability.
Have you ever
So,
guys ever read this book? It's called Views from Our Shoes.
mm-mm.
It's about kids with siblings who have
Mhm.
special needs, and it's written by them, and how
Okay.
the same thing, like your
Yeah.
son, how they feel like
Mhm.
it's a phase that they're going through, that they're like, I just want him to be like everyone else. And then I was like,
Yeah.
well, if they were, all you do is fight with them. So,
Right.
but it's a really good book. It's not a very big book, but it's called Views from Our Shoes. And that
Okay.
the entire book is about all the different kids and how their thoughts are. Same thing like your son is saying. And it's a very easy read. I had it and I gave it to someone, or I would give it to you, but it might be something good for him to look at, because it kind of explains the same thing. Like
Yeah.
at first they said when someone would come over, the people would stare or look and they didn't know what to say. And they don't,
Mhm.
at that age, they don't want to stand out in any way, shape, or form.
Right. They want to fit in.
Hmm.
Mhm.
Yeah.
And
But
so,
that's
yeah.
understandable, that. And then in his mind, he's probably like, well, what? There's not, he's so used to her that it's
Mhm.
not unusual for him.
Yeah.
Bringing attention to it. He's like trying to figure it out because he's still young, processing everything.
Right.
Yeah.
You're not a bad mom.
Luckily, there's a lot coming through where there's just so many things that are highlighting special needs now. And I always say, I'm so glad this isn't 20 or 30 years ago, because I don't know if I could do it. But,
Right.
there's restaurants and places and things that it's not unusual, to me, like even soldiers who have before would have, you would have stared if they didn't have a leg. Now you might see them with a tie and you're like, oh, cool. To me, it looks really cool. And you think, wow, that's, you don't stare and you don't look twice. If you see somebody with like a titanium leg or something, you're just kind of like, oh, that's such a cool leg. Whereas 20 years ago, you would have been like,
Mhm. Yeah.
now you barely even look twice when you see things like that. You just, so luckily more and more of that is coming into our daily lives, I should say. So, I think it's just a tough age, regardless of what they're going through.
Yeah.
And that's why we
And
do this podcast, to just make sure families continue to know the different resources that are out there, just like how you mentioned the book, because there's other siblings that are going through that as well.
Mhm.
And we just need to know we're not alone. Technology, I feel, has changed the game for the whole special needs community. You're able to reach out to parents in California, New York, and see what resources they have and try to bring them back to your state.
mhm.
We're very fortunate in the county of Duval to have Wolfson's, to have Brooks, Wolfson's, Early Steps, so many resources. It's just making sure we continue to educate the community and let them know that this resource is here. It's free of charge. They come to your house. And you really need it because you want the best for your child.
Yeah, I see sometimes I don't comment, and sometimes I do look at the Facebook pages, and I try not to comment on them all the time, because it is my job, and I don't want to. But I see everybody being like, oh, get in Early Steps because you can get this and this and this and this. And I'm like, that's really not what it's for.
Mhm.
They will bill your insurance. It is
Right.
free, but we will bill your insurance. And it is not that you're going to get 5, 6, 7 therapies a week. That is not the purpose. That nobody lives a normal life like that. That's, the
Mhm.
point of Early Steps is to try to be as least intrusive and still get something done in a natural environment. And by coming and sending PT, OT, IT, somebody every single day to your house, that's not
Mhm.
natural. That's not what
Yeah.
we're providing. We need to focus on one thing at a time, and working with those families and working with the skill that we really want to. Now, let's say we get 6 weeks into it and we're progressing on that speech and we're not seeing as many problems. Hey, maybe we can switch to another discipline right now, and we can have a meeting and we can move, but we're not going to call in 5 or 6 different therapists a week. That's not the Early Steps model. It is a teaching model. It is for parents to understand that you are your biggest advocate, whether you want to believe that or not. We know, because we've been going through this, But when a family is first starting, we have our job is to get them to where, not where we are, because we're constantly learning and working, but on that path of learning and coaching and working and being your child's voice and teaching them as much as you can teach them without always feeling like, oh my gosh, it's another therapy session and I'm at Brooks and I'm at Wilson's. And I always say I should have a special parking spot at Nemours, but you probably feel like that. We probably all feel like we should have a spot, because I think we've gone probably on every single floor for something at this point, and then the UF doctors and then Wolfson's. And so, but prior to that, I was like, I went to the pediatrician every 4 or 5 months with those kids and didn't even know what any of this is. I never even noticed there was a, like, going over 95 until we went and walked across the walkway that it was even
Yeah.
there. Because I'll say to people,
Or that it connected together. So to break it down for our families or viewers, basically the Early Steps program is here for families that they have a child that they are seeing some type of delay or concern, and Early Steps wants to come in and assist that family with their child to kind of hone in or work on or focus on that specific delay, whether it's cognitive, physical, or
fine
what have
motor,
you.
communication.
Yeah. And so don't expect it's not going to be, you're going to get all the therapies in one session. They want to focus on one thing at a time, because they want to focus on what the child is struggling on the most to be able to help increase that skill or development that they are delayed in. And what families can understand is that when you're working on that skill that that child is delayed in the most, that once they are able to build the skills in that one area, that is going to lead into helping progress into those other things, because everything is connecting to one another.
Right.
So it's not a bad thing. And like you said, you can still go and get your outside therapies as well, or continue any outside therapies that you are receiving, but they want to come in and like specialize in that specific area for that child to be able to grow in.
Right. So we can't duplicate services. So it's not like you can have PT Monday morning and then Monday afternoon go off to PT somewhere else. The best thing I tell families, I give all my families in Early Steps have my cell phone number, and it's my personal cell phone number that my husband and my kids and everybody else uses, so that they always feel like they have that support. That's my job, is that they have support, that if something's just not, maybe something, like they don't want to tell their provider that something's happening, that or someone's not showing up, or just what I want them to feel like they can talk to me and I can try to help them, that we need to try to work together as a team. And you as a parent, you're here, you're the main member of that team, and we bring together everyone else. And as we work together, we want to work on, on a goal, that something that you feel is important for your child to work on. Maybe it's something that we're seeing and we can, help you with that, but you're the family, you're the parent, you're the one who really wants to work with that child, to teach them, we coach you to work with that child and to help make that change in their life, because you're there every day. We're there for an hour. You're there every day. So our job is to coach you and to work with you and to make you know that you are part of that the family team member, but to work on goals and to as a team, work on that progress and see how we can't get, hopefully, moving forward on some of the things that you see that the child is struggling with.
So a couple of questions and before we close out. So what can a family do to prepare for exiting or leaving the Early Steps program? What are some things that they can do to prepare for that, especially if their child still needs to have services?
Okay,
and
so
if they're not already,
Around, and again, like I said, now factor in that we're coming off COVID, but and there are guidelines that we follow by, and we try as hard as we can to keep these on schedule. Around 90 days prior to the child's third birthday is when the transition process will start. You'll get the letters, you'll get the information, and then you'll have the meetings with someone from Early Steps, someone from the school system, and that's where we go through all the process of getting the child transitioned out, tested to find out if they are actually eligible for. We don't make that determination. If your child is aging out at the age of 3 and going to Clay or Duval or St. John's or whatever county they're going to, when they age out and they go through that testing, it's not an Early Steps decision. It is now gone from being, the family home and the environment to a school-based system where there are now goals or education based, as opposed to the natural environment where they are now going to start testing you to work on things that education wise. And so the school system will start doing testing and doing different things with you to help you transition out and figure out whether or not your child will actually qualify to go into that program. So all of that's taken care of through Early Steps, and your service coordinator and the transition specialist and someone from the county will work with you to hopefully get that smooth transition.
Yeah. And so lastly, where can families find information about Early Steps? I know we said that their pediatrician should be able to have this information. Are there any other places that families are able to find info?
The pediatrician, we have brochures, we have a website. The state has a website. Let me pull it up so I make sure I give it to you. I hope this doesn't knock me off, but I'm going to make sure that I look this up because we just redid. There we go. It's the Early Steps website for Florida. And it is, I think if I copy it, I think I can put it into the chat.
Okay.
So let's see.
And we'll put it in the description box on the.
Yeah.
There.
So here is some information here. I'm going to put that here. And then go here. And I know we just did a brand new one. And I want to find that one because that's a really nice Early Steps where that will give you. But if a family's concerned and they feel their doctor or someone is dismissing them, and they truly feel that they would like us to talk to them or they want to make a referral, they are more than welcome to call our number. And I can put that in here too. I'll put that in there as opposed to reading that to you.
Yeah, and I can definitely post this on the episode info also.
7600. Okay, so that's our main number, and they can call and ask. It'll prompt you through and tell them that that they're doing a self-referral, that they want to refer them, that they're and they'll do a screening. They'll talk to them so that, because let's face it, there are moms who are like, my child had a fever for a week. They need to be in Early Steps, where they don't understand that. They may not understand it, but oftentimes that's fewer and far between than maybe a mom who really has concerns. And I never want them to feel dismissed over something that they are really truly concerned about, that a doctor should dismiss them or any kind of caretaker if there's something that they truly feel that their child should be doing. I always say, talk to us and let us figure this out, as opposed to just pushing it to the side and not listening to what you're feeling here.
Yeah. So all this information and a bunch of other information will be posted on our website when we finish the website. So we will definitely have links and telephone numbers to Early Steps for everyone to be able to access that. And if you have questions, then please feel free to reach out to us, Two Moms and Some Labels, on our YouTube channel in the comments section. Make sure that you subscribe to our channel. And you can also listen to us on Spotify, Two Moms and Some Labels. And we hope that this episode was very informational and that you are ready to reach out and get help if it's something that you needed, or you've been thinking about, or you have noticed that you are going to take the further steps to be able to assist your child or your family. And we just want to thank you guys so much for tuning in. Thank you so much, Melanie, for
You're
taking
so
the time
welcome.
out
Thank
of your
you.
busy
It's
day
so nice to meet
to
you.
meet with us.
I know Brittany, but it was really, really nice to meet you.
Yes.
Yeah. And so thank you once again.
you.
This is Two Moms and Some Labels signing off. We will see you guys next time.
Thank
Thank
you.
you.
Bye. Thank you.